Thank you very much. We're going to move on to item 9.2. Receive, report, and presentation and provide input on draft Santa Clara County Community Plan to End Homelessness and Gilroy Data Progress and Partnership. Big line of people there.
Good evening, Mayor and Council members and members of the community. Sharon Goei again, Community Development Director. In 2020, the Santa Clara County Continuum of Care developed the 2020-2025 Community Plan to End Homelessness. So last year, they started engaging with all the stakeholders and all of their partners again, including all the jurisdictions in Santa Clara County, to outline the next 5-year roadmap. So tonight we have a representative from the county and also from the Santa Clara County Housing Authority to do a joint presentation. So I'll turn this over to them and let them introduce themselves. Thank you.
Good evening, Mayor, Vice Mayor, Mayor Pro Tem, Council members. My name is Rebecca Garcia, Housing Director for Santa Clara County Housing Authority. I'm joined by my colleague Catherine Kaminsky, also known as KJ, with the Office of Supportive Housing County of Santa Clara. I'm going to go fast and furious because I know you have a long night and we have a lot of information before you. I want to tell you it's quite a treat for me to be here with you. I'm a Gilroy girl born and raised, and I still live here and care very much about this issue that I've worked on for 20 years. So thank you for allowing me the privilege to be here with you. I get to present a lot, but not in front of you, so I'm thrilled to be by my neighbors. So this evening we'll be covering a few key topics. First, we're going to be looking at the progress. Thank you. From the 2020-25 community plan, sharing some of the results and the impacts we had in the community, in our community specifically. We're also going to be talking about Gilroy households data and what work that was done here in our community with our community partners, many of them who are here this evening, and our city colleagues as well. And then lastly, we'll be looking at developing the next 5-year plan. Before we get into all of that, I want to give you a sense of what we mean when we say a supportive housing system. The supportive housing system for us is really a coordinated system of entry of how we address homelessness in a community. There's different interventions when you're dealing with homelessness, interim housing, permanent supportive housing, rapid rehousing, homeless prevention, but I've been in this work long enough to tell you that we weren't as coordinated as we are today, and it's not lost on me that we still have a lot of work to do. As I mentioned, I live here, so I still see our neighbors living outside, so as we give you some positive data, we recognize that we do still have a lot of work to do. So for a long time, if you were homeless, you would go to a shelter. You might get lucky and find a case manager. You might not. You'd work with a nonprofit organization that you know, but there wasn't a system that would actually bring everybody in a coordinated way. When the county formed the Office of Supportive Housing back in 2015, we were able to begin to centralize resources within our county. At that time, I was working for the County of Santa Clara, and some county homeless services were in the planning department. Under the office, back then what was called the Office of Affordable Housing, and then a lot of the behavioral health, mental health stuff was in the behavioral health department. So we merged, we got smarter, and we merged those two departments to develop the Office of Supportive Housing and be more responsive to this incredibly complicated issue. We created a system where if you're homeless in the community and you get contacted or you need help, there's someone you can go and speak to, and they put you through a system and work to provide you with supportive services and the support you need. This could be a family who's working and experienced some hard times, an unexpected situation that arises, and they're about to have to exit their home. Homeless prevention may be the right fit for them. Or it could be a senior who has, who's chronically homeless and has some type of disabling condition, whether it be mental health or physical. And seniors often on fixed incomes with fixed incomes not rising and rents continuing to rise are at the top of our list of people we need to support. And if you're young and you're aging out of the foster care system, there could be a transitional subsidy to get you where you need to go. So the goal of our supportive housing system at its best is capturing all those needs for our entire county and providing people with the best intervention to end their homelessness. Albeit we have not solved it for everybody, definitely want to recognize that and hear the comments of folks in the audience. So about the continuum of care, all of this work is organized around what we call our continuum of care. That's a fancy word, but it's really just all of our nonprofit partners, the county, the housing authority, the city, all of us working together to move in the right direction, in the same direction at the same time. philanthropic partners, individuals with lived experience. One of the things that we have learned about all of our different systems, whether it's the housing authority, the county, listening to people who actually have been homeless or are currently homeless is extremely important in figuring out how we do this work better. And the County of Santa Clara serves as the lead agency in this work. So our collective impact, again, involves a lot of different folks. I won't repeat it. And the progress, Catherine gave me the honor of being able to share some of the progress from the 2020 to 2025 community plan, which is essentially the past 5 years. So proud to report that we have actually housed 20,000 people. We're excited that we were able to do that in this time period. That means taking people who are accessing homeless shelters, interim housing, and placing them into permanent supportive housing countywide and essentially ending their homelessness. I think what's most exciting about this number and this work is that over 90% of the people that we're placing in long-term housing solutions are staying housed over time. So we know that the work that we're doing now, we've been in it long enough to know that it is working and it is moving in the right direction. And it's not just for one single population. We have a wide cohort of individuals. We have individuals who are young, chronically homeless, seniors, but we're also seeing a quarter of them as families with children. We're seeing young adults, veterans, seniors, and seniors, as I mentioned earlier, are really a growing concern for us as a community as we continue to see them outdoors for the very first time. People who've often lived in our community their whole lives are finding themselves homeless for the first time. Temporary housing and shelter capacity has increased by 82%. Housing alone isn't enough, although that is the primary driver in solving this issue, but we know we have more people outside right now who need more immediate help. The plan actually called for doubling our shelter capacity. We did not quite meet that yet. We reached it by 82% over that 5-year time period. And then homeless prevention achievements. This is one of the one I think is really important to spend a moment on. So the homeless prevention really just started with the county asking a couple of, we asked all the cities at that time to contribute to this idea that if we start to help people and prevent them from becoming homeless in the first place, we will start to get a little bit ahead of this. And so since then, the homeless prevention system has significantly grown. Destination Home has had a big part in that. And in the past 5 years, we've served 38,000 people through the homeless prevention system, meaning right-sized financial support and case management to keep people safe and in their homes. One of the things I really love about the homeless prevention infrastructure that's been in place is it's very sensitive to where you're at in the county. So here in the southern part of the county, it's South County Community Services. In the northern part, it's Sunny Valley Community Services. And then in central San Jose, it is Sacred Heart Community Services. So very localized and responsive to the needs of our local residents. This is one of the most cost-effective and highest returns on our investments that we have seen, and we are finally able to do it at a much greater scale. For a system that in 2017, when we started it, was really just serving a couple hundred households with support from cities and nonprofit partners. And the result is that we're now seeing a decrease in new households becoming homeless. When we started this work, for every one household that we housed, another 2.5 were becoming homeless. So that was discouraging. But today, for every one household that we have, only 1.9 are becoming homeless. So we're definitely not all the way there yet, and we want to see that number below 1. But it is getting us to a point in our community work we can see some functional decreases in homelessness and progress towards this longer-term goal. We're excited for the results of this work, and I'm now going to turn it over to Catherine Kaminsky from the County of Santa Clara, Director of the Office of Supportive Housing.
Thank you, Rebecca, and thank you, Mayor Pro Tem, and council members for having us here today. I am going to share a little bit of information about Rebecca shared a lot of information about our countywide progress. I'm going to share what does that look like for households that are from Gilroy here? And then I'm also going to share a little bit about the next steps in the community plan. So just to start off, in terms of demographics, we included some information. Sharon talked about the point-in-time count, but we also look at understanding the population of people experiencing homelessness through housing assessments. We use a standardized assessment across the entire county for households that identified as affiliated with Gilroy. That could be they work here, they were last housed here, they have children who go to school here. We see that there's a range of ages of people experiencing homelessness. 81% are single adults, but we also have 14% were households with children, and 63% identified as man, whereas 37% identified as women. This pretty much is aligned with what we see countywide. We also ask questions about how long they've been experiencing homelessness, where are they currently sleeping. In the data set that we looked at for the past year, the majority of households, Gilroy-affiliated households, reported experiencing homelessness for 2 or more years. And 42% reported sleeping outdoors, followed by 24% in a vehicle. Again, fairly aligned with what we see in countywide trends. There are 2 separate data points where we saw some variation for households specifically from Gilroy. A higher percentage identified as Hispanic or Latino, 72% roughly compared to 53% countywide as a whole. And then separately, the other data point where we saw a difference was the need. Gilroy-affiliated households were more likely to report higher levels of need for permanent supportive housing. It was 81% for those assessed from Gilroy compared to 53% of the county. This slide is to try to take those countywide numbers and translate it into what did that mean for households in Gilroy. So we housed collectively across the county 20,830 folks from 2020 to 2025. 1,999 were people from the city of Gilroy. In terms of the folks we served in shelter over that 5-year period, over 3,000 were from the city of Gilroy, and in the prevention system, we served over 2,600 people from Gilroy. Now, the data point that we often look at, that we want to be at a point where we're housing more people than we're seeing for the first time to really make progress on the overall population of people who are experiencing homelessness. Countywide, when we started the plan, we were at a point of, for every household we housed, another 2.4 became homeless. We were seeing that consistently. Now, countywide, we're at a point where we see for every household that is being placed into permanent housing, 1.9 is becoming homeless. So we've made progress, but we have a long way to go. When we look at this data for Gilroy, for last year, for every 1 household we housed, another 1.1 became homeless. So that is trending in the right direction. Of course, we still want to see that ratio shift over time. If we look at efforts like our support for veterans, we see that that ratio is flipped because there are more resources available, permanent housing resources available for veterans, and we're consistently housing more people than we're seeing come into our system for the first time. That's where we want to get for everybody. We also provide this slide provides some information of how people from Gilroy are being served in that supportive housing system that Rebecca described. I'll just highlight a couple of things here. Because that need, folks are showing a high need for permanent supportive housing, you have a higher proportional rate of folks getting referred and into permanent housing, supportive housing. And I'll also note, one of the speakers, Jan, noted how the advocates and service providers here in the community help people get ready for permanent supportive housing. That partnership is critical, working with our team to make sure folks have the documents they need and are able to make those appointments. But we also saw high numbers of folks being served in emergency shelter, 570 households served last year, and homelessness prevention, 183. We wanted to translate that into what does it look like in terms of investments. So we pulled out a few examples here. For permanent supportive housing, the average cost for the subsidy and the services, subsidy sometimes is provided by the housing authority, sometimes provided by the county. That total averages around $37,000 a year. So for those 434 households from Gilroy, that's about $16.2 million investment. For rapid rehousing, it's about a $2.9 million investment for the folks served last year, and for prevention, it's about $2.8 million. So these are just a sampling of what our collective community is investing to support households here in Gilroy. I also wanted to include just some additional partnerships. Sharon mentioned some of these too on the next couple of slides, but we know affordable housing is what is going to help us solve homelessness for our entire community. We've invested in affordable housing development like Monterey Gateway senior apartments. We also fund supportive services and sites that are based here in Gilroy, including Monterey Gateway, Gilroy Sobrato Studios, and Sobrato Family Apartments. And then, of course, we've spoken about the Gilroy Armory and the Ochoa Cold Weather Shelter, which represent investments of a little over $4 million a year. We also fund outreach through the South County Community Services, and I won't go into too much detail because Sharon did such a good job describing our partnership on PLHA and CDBG and that coordination across the county. So we are in the process of reflecting on the progress, reflecting on the challenges that still face us, and updating our plan for the next 5 years. This has been well underway for over a year, where we've been bringing together stakeholders, including folks here tonight and folks from South County, from Gilroy, and really looking at the data, looking at the solutions, and convening folks with lived experience. We have a cities working group, trying to get as much information as we can and reflecting on 5 years of work to help us to draft the strategies for the next plan. We hope to have, the draft plan is out now. We hope to adopt it by the end of the summer, early fall, and then we would be going to groups like city councils, the Board of Supervisors, and others to endorse it. The draft plan was attached to the staff report, but I'll give a high-level overview of what the focus areas look like here. The first area, we are focusing on prevention because we know to make progress, we have to stop people from entering our homelessness system in the first place. It's cost effective and it's humane. So the first area is around prevention. The second area is around focusing on our continuum of housing programs, from temporary to interim to permanent housing programs, and how do we continue to expand those and improve those services that we're providing. The third area of focus is, as well, we know permanent housing is a solution. We know folks are also experiencing unsheltered homelessness right now, and we want to work to improve access to critical services while they're outside. And then lastly, while we do this work, we know the people that know the most about our system are folks who have been served in our community, who are experiencing homelessness today, and that we should be prioritizing their voice and helping lead this work. I mentioned the community engagement phase is underway now. We had a great meeting last week here in Gilroy and got a really wonderful turnout and amazing feedback from community members. We're taking that to influence the draft plan. We are also working on sub-regional plans over the next couple of months, recognizing there's some shared concerns within sub-regions of the county. And those sub-regional plans, we're looking to include a description of what the characteristics of the region. So for we have South County, North County, West Valley, and San Jose. And also looking at a summary of those existing efforts in those areas, and hopefully developing a sort of shared framework of goals and priorities that will help guide our work together, the county, nonprofits, cities, in when working in those subregions. So I got a little ahead of myself. I mentioned we had the South County convening last week and got great feedback, but there's also a virtual meeting next month that's open to everybody. And there's also, the draft plan is posted on the county's website with email address if people would like to provide information, feedback on the plan via survey or written feedback. So again, thank you for making the time for us. Really what we'd like to, what we're hoping to hear are these focus areas reflective of the needs and goals of your community here in Gilroy? What are your priorities that you'd like to see in the sub-regional plan for South County, and how we can work with you all to share this information with the community? And with that, we're here for any questions.
Why don't I send it back to Councilmember Ramirez, since you ended off with questions for them?
Thank you, Mayor. Okay, trying to figure out where to start here. So on, I believe it was slide 19, you indicated that you're exploring the 8th and Alexander project. So my understanding is that was approved in 23. Can you provide me with, you know, an update? Like, you know, my understanding, it's kind of shifted directions over the years, and it is supposed to be affordable housing. We've been waiting for this. You know, when do you anticipate breaking ground, move in? What's the timeline on that?
Thank you for the question, Councilmember Ramirez. Exploring probably isn't the right word to use for that slide, so I apologize. We are working, the county is working with the Housing Authority, who is also has contracted with a community engagement firm, and we're actively in community engagement phase for that project. So it will be affordable housing. We aren't exploring affordable housing there. The funding isn't set aside yet for it, but the community is helping provide input. It has been identified for agricultural workers, a focus on agricultural workers, so we're meeting with agricultural workers and service providers who work with that community to learn more about the needs, to help us design and develop the plan for that site. I don't have a date on when we would break ground. I think we're in the community listening phase for that.
What other phases will follow?
Then there's a design phase and the
Entitlement phase.
and entitlements, right, with and working with the city on the entitlements, and of course trying to pull together the financing for that project.
So 5-10 years? I mean, realistically, what are we looking at? I'm not going to hold you to this, but I mean, just
Affordable projects can take anywhere from 5, 8 years, 7 years. It's competitive. When you get everything you need, it's still a competitive process, so it's ultimately up to
so it wouldn't be 7 years from 23 because we're already at 26. That would be another 4 years.
I wouldn't be surprised if it was another 4, but I hope it's not.
Okay, and then on March 25th, I attended the Santa Clara County Housing and Community Development Advisory Committee meeting where I hold a seat representing Gilroy. And you spoke about the home funding of $786,723, which in the packet was identified for new construction, acquisition with rehab, or other eligible projects. And given that we get our own CDBG funding, we are not part of the county's CDBG, so we get part of the home funding. So when I asked what specifically would be provided to Gilroy, I was told that funding for the 8th and Alexander project. When I asked how much would be allocated and what would it be provided for, I was told I would get an email, but I have not yet been given that information. So perhaps.
My apologies. I can follow up with staff to make sure we provide that information. And you know, the home funds, we do fund projects all over the county, but certainly 8th and Alexander is a project that we are looking at for our home dollars.
And I certainly. I should back up a little bit and say, you know, thank you for all you do, you know, for the unhoused. I can't imagine your jobs, right? But as I sit here, I sit representing the people here. And so I have to ask these questions and I have to push. Mm-hmm. So then one of your slides, I think it was the last one that asked, well, first of all, you talked about the higher level of need. We've already discussed that Gilroy has the highest percentage of unhoused per capita. You identified that we have a higher level of need. Does the county spending reflect that?
The enrollments in permanent supportive housing do reflect that, and that spending that is associated with permanent supportive housing reflects that. So when we look at the proportion of people experiencing homelessness in Gilroy from the PIT count or from the housing assessments, enrollments in permanent supportive housing programs and the spending associated with keeping people housed in permanent supportive housing programs is higher.
Okay, and then the other.
Let me jump to Councilmember Fugazi.
Can I have just one more question, please? Just one more?
Okay, one.
Okay, one. Thank you. You did ask for, your last slide was asking like what we would like to see or have or something. I'm just hopeful that perhaps maybe the land that has been identified for 8th and Alexander, maybe if we find some kind of temporary use until that permanent, that would be what I would advocate for. Thank you.
Thank you. Councilmember Fugazi.
So I'm glad we have the experts in this, because I've got like the question that I've had forever that I can't understand, and I hope you have the answer to this, because it is such a statistical outlier. Why is Gilroy so much higher than everywhere else? Mathematically, and I just ran the numbers, we would be in the 99.98 percentile in the county and close to the same even statewide for cities that are our size. There has to be, and I would expect that this would be almost a forest fire in the county to try to understand why it's so bad. And then also tell me after that what specifically, if you have something that's different here, that we're doing different for Gilroy than every place else.
I'm going to take a stab at that. I would answer that question the way I would respond to any city. I currently work for the Housing Authority, but most of my experience is actually working with cities and small cities, Morgan Hill specifically. But just as an example, about 10 years ago, Morgan Hill experienced a very high increase in homelessness as well, at the same time Gilroy did. And my response to them was, you can pay for it now or you can pay for it later, but you better get ahead of it, because once it starts and it expands, it's really hard to claw that back, because encampments are incredibly expensive, as you've talked about already this evening. So I would ask a city what exactly has been done from the city's perspective or community to be super proactive and address that. I know we have newer council members and a new mayor, but my observation of not just Gilroy, but really all of the cities in the county is their approach has been very different, and a lot of time gets spent, because it's a really complicated issue and it's new to most people. So a lot of time gets spent philosophically talking about why someone's homeless, or, the whole blaming thing. And it takes a while longer to really get to the action items. Like,
So I mean, that's not really a specific. There's nothing specific in what you're saying in terms of, there's plenty of cities across the state who do this poorly, even more poorly than Gilroy, and don't have the numbers that we have. So are we twice as, maybe almost 3 times as likely to be poor, or 3 times as likely? Statistically, this is so far out of the realm that it would make, if it was in the private sector and you were that far out, right, in your in 2 different departments, you would be everything would be focused on that, because how could it be so far out of order?
yeah, I don't think there's one answer. I think it's a lower.
Give me 3.
Lower socioeconomic status. What's the housing production been in the community to address that? Do we have an inclusionary housing ordinance that contributes extremely low-income housing in lieu fees that build the affordable housing? Do we have a safe parking program? I think the answer there now is yes, but there was a lot of check boxes that did not get checked off over the past decade, and you do have some great work, which you've all heard about this evening, that came about in the past couple of years.
There's plenty of other cities that have done worse than us. Anyway, okay, so on the budget that you said, so how much total county is spent towards the homelessness prevention and doors and all of it all together? I mean, I looked it up, it said 120 million, but it's got to be more than that, right?
It is more than that. So across the county, for last year, I think it was over 400 million. But some of the programs that I talked about tonight, because that includes housing programs for folk like associated with our behavioral health system, for example. But for the programs we were speaking to tonight for homelessness prevention, it's about $30 million annually total. For temporary housing, it's about $45 million annually.
You had 21 million, I thought, just for Gilroy, though, right? For prevention.
No, 2 million was for for prevention.
No, in
I
total.
think it was
Because one of them was 16 million.
right. That was permanent supportive housing.
Oh, okay.
So the permanent supportive housing is investments that's reflective of both housing authority vouchers, because our housing authority has been very aligned in working with us to address homelessness in our community and dedicating vouchers, as well as county funded supportive services and the case management that are provided to folks, as well as some subsidies.
So 400 million in total was the full net, right? And then
Yeah, I can follow up with, we have some.
And Gilroy's percentage of overall homelessness in the county is how much?
From the point in time count, I think it's about 8% from the folks that were assessed last year, somewhere 8 to 9%.
Okay. And what do you do with individuals who don't want housing?
Yeah, we have special. Well, first of all, there's very few individuals who don't want permanent housing. So
We had one individual from the public come up and say that it's so super hard, some people don't want to go into it, et cetera. So
Sure.
That's what I mean.
temporary housing, sometimes temporary settings aren't they don't meet the needs of people as they're set up. Either they're congregate settings, they may be mixed gender settings, they may have pets and we can't accommodate pets. There are multiple reasons why temporary housing sometimes doesn't meet the need. A specific shelter doesn't meet the need for somebody. We have very, very few people who, when offered permanent housing, would decline it. Of the vast majority are interested and work towards permanent housing.
And those
They're
that don't
two
want it, though, what do we
separate
do?
than-
What do we do with the ones that don't want it?
We can't force them, but we do have specialized teams that work with folks who may, be experiencing challenges that they need to address first, and that we can connect them with the services to help them address those challenges first. We don't give up on them, but we don't force them either. So people, if they say no to housing, they don't. It's not a no for life. They can decline a program.
One last question, Greg. Thank you. One last question. So in your report, there was no mention at all of substance abuse help, any of the things. There's a lot of, in the point in time report, it talks about why people get homeless, which can be an intermediate stage from those abuse cycles that happen. You get kicked out of your apartment or what have you. So can you comment why that's not at all part of this whole program?
Yeah, thanks for the question. It is a part of the program. So part of our permanent housing programs and our temporary housing programs are connecting them with mental health or substance use services and making sure those are available and accessible. They aren't part of this presentation primarily because we were focused on the causes and solutions to homelessness, of which they are a part. But the primary driver of homelessness in our community and in communities across the nation is a shortage of affordable housing and wages that allow folks to afford housing in that region. So when we're talking about our overall strategy, it does include housing solutions. That focus area 3 that I spoke to includes, if we look at the sub-strategies, connecting people with mental health and behavioral health services, but also our housing programs do that. We have those services available for folks who need them. So
okay, it's just strange.
They're part of it.
There, so thank you.
Yep.
All right, I think that concludes questions from council. I'm going to jump to public comment, please.
Thank you. Robert Aguirre, followed by Elizabeth Stone, and then Ron Kirkish.
All right, so I just want to point out some of the things that we're talking about here is your question about people refusing. Okay, so this is very much the same thing that happens when people are arrested and they're taken into a tank or holding cell, and they're usually handed a sandwich, and that sandwich, more times than not, is peanut butter, maybe peanut butter and jelly. The thing is that if somebody goes in there and they have either a peanut butter or a peanut allergy, and then they refuse that sandwich, can you say that they're refusing the service that they're being given or being offered? So sometimes just because you offer something to somebody doesn't mean that it's going to meet their needs. And I think that's very important that you understand that. And I want to know a couple of things. How many Gilroy unhoused and formerly unhoused are involved in the planning that's going to be going on? I saw that you guys are involving some people that are unhoused and formerly unhoused, but I don't know how many of those are from Gilroy. And I do know that we've had many 5-year plans for many years, decades that I know that I'm aware of. And I know that this last 5-year period was helped very much by Measure A funds that were allowed to build housing that we don't have anymore. And the other thing is that the pandemic also was very helpful in reducing those numbers because there was a lot more federal funding that was being provided. Well, now we're looking at a situation where we have an administration that's cutting HUD funding. And HUD funding is your bread and butter, right? Maybe even, maybe even the peanut butter too. All right. So I want to know, what is Gilroy's plan for solving the unhoused crisis? Because this is a crisis, and we can't just continue to ignore it. And how will you meet your housing element for ELI, BLI, and LI housing? Because traditionally, for decades, the housing elements have met their requirements for market value and luxury, and they've exceeded over 100% of the planned amount. But the ELI, BLI housing has not been met, like I said, for decades, since Ronald Reagan's time, actually. And the housing that's being planned, you say, is for farm workers. But what about everybody else? So if we're spending all this money to house farm workers, which I think is a good thing to do, but what is the plan for people that are not farm workers? What are we going to do with that? And so I think, let me see, I'm at 14 seconds. Okay, so again, my big question is, how is Gilroy going to do their part, apart from what the county's doing and the housing authority is doing? What is Gilroy going to do to solve this problem?
Elizabeth?
Good evening again. So I did attend the community discussion at CADAS, and there's a lot of really good ideas from other people that also had lived experience. In the little breakout room that I was in, because we broke up into 4 groups, every single person that was in that circle with me was someone that is either currently unhoused or had recently been. And just to be clear, I became unhoused July 9th, and January 2nd of this year, I moved into senior housing, which is actually interesting because people that live outside, and it's over 25% of people in Gilroy who are over age 55, someone who has lived outside for more than a year is chronically homeless. People aged 50, because of the difficulty of living outside, physically are as frail as people aged 70 who are housed. Yet, the people that are dying are 2 groups. Young people that are dying of overdoses and people between 50 and 62 because they have those medical and emotional needs, but they don't qualify for those programs. So that's one thing to be thinking about in terms of input you give to the county, but also when the item comes up, 7.1, and we're looking at what this town would like to do, that's one thing to keep in mind. The whole accessibility, which Robert kind of mentioned, if you can't climb to a top bunk and you say, I can't use this service, or the workers are like, if you're in a wheelchair, it's a little too much for us to handle in this program, those are people that are dying as well. Okay? I previously had a lot of mobility difficulties, so I understand it's really challenging when it's very difficult. The other thing that I want to really call your attention to, because this topic right now is the county plan. I went to the housing conference in Sacramento last year, and let me just back up one sec. I also lived in a different county prior to this where I had written grants and had over $500,000 to work with people that had behavioral health, substance use, justice involvement, or were unhoused. So for the past 4 or 5 years, I've been watching the state roll out what's now Prop 1. So I'm really familiar with like what the state's intention is with that funding. And that's really kind of missing. There's a lot of money from the Behavioral Health Services Act stuff. And the Behavioral Health Integrated Plan, which is under public comment right now, 1/3 of that money has to go to housing. And it was really mentioned at this conference last year, these two systems are not talking. There's resources there, and they're not working together. One talks about households, one talks about units, etc. So those are just some areas I hope you look at. Thank you.
I think Ron's next, and then Anne Marie.
Hello again, Mayor and Council. Somebody that's observing this meeting sent me a text message. The concern is the location, 8th and Alexander. Isn't that downtown? Isn't that like a block away from downtown? And aren't we trying to clean up our downtown, make it more beautiful, make it more reflective of the kind of downtown we want people to come and visit, like a tourist event? So why aren't we talking about that? Do we really want this? I know it's county property. At one point, they wanted to put the overflow of COVID patients there for temporarily, but that's over now. So now that is county property. But it also is something that I think is important to consider. Do we want something like this located at our downtown? Thank you.
Thank you. Anne Marie.
Terrence. So, my favorite city council member. I've been sober 31 years. I have been on both sides of recovery, and I think some of my other people here that are also sober, bluntly, drug addicts and alcoholics used to be able to still afford housing. So we did. We all lived in a place together. It was affordable even for that population. When I first moved to Gilroy in 2024, I lived next to a drug house, and there was probably 15 people living there. I didn't like it, but it was worth $750,000, so the people sold it, and then now those are 15 people that are not housed. So it's not even about the demographic. No one can afford it. It's just. And I think that what's happened is the community thinks that there's this big increase in drugs and drug addiction. It's always been there. It's just you see it now. You see that now. And that's why that needs to be addressed in another way. It's another conversation, but it does need to be addressed another way. And yes, Gilroy is the worst. It handled the worst in the last 10 years. Rebecca was very polite. I talked to other cities, I reached out, and we've done a horrible job. So this is the consequence that we're seeing of doing nothing. Thank you.
Thank you.
I have no further speakers.
All right, I think that concludes. Any other questions for staff or anybody? So that concludes. Thank you very much for you guys for submitting that report. Thank you guys for coming from the county.